I'm Jeremy with the American Diabetes Association. I'm here today with Dr. Lyons to talk about research here in Oklahoma specific to diabetes. And Dr. Lyons, would you tell us more about your research program, in specific how the ADA has helped you with that?
Well, thanks, Jeremy. So ADA support has really been critical to what we've been trying to do, which is to understand the reasons why people with diabetes develop complications, especially blindness and kidney failure, to understand the mechanisms of those problems and to learn how to do something about them, to stop them from happening and to treat them when they do happen.
Since I started my diabetes research, that time I was in South Carolina, Charleston, South Carolina, working with Dr. Lyons, and we have a collaboration project. And the first grant I got for my research is from ADA. Yeah, my work have been several parts in mainly in diabetes complications. The first part is the protective system in the eye, which is protect against diabetic retinopathy, which is eye complications. As we know, not every diabetes patient develop eye complication. So we found that there's some kind of protective system in the eye. There's a balance, the bad factors and the good factors. In the diabetes, the bad factor increase, the good factor decrease. Therefore, the balance in the young disturbed.
And of course, there's a huge problem in our state as well as in every other state and indeed in the world in general. This is a problem of immense scope and immense importance for public health and for the health of mankind in the coming century. Finally, I should add that the Harold Ham Diabetes Centre has been founded here over the last 5 years. That's a centre which we hope will share the goals of ADA, and that working together we will be able to do something really dramatic to address the diabetes problem within the next decade or so.
Fighting diabetes is still an unmet medical need, not to this country and even to the world. And I have a long-standing interest and also passion for basic biomedical research, because I believe basic research can make the difference.
This is Dr. Zhang. She's the assistant professor here at the Medical Center, also doing diabetes research here in Oklahoma City. Dr. Zhang, can you tell us how ADA funding is helping you in your research?
Yes, absolutely. My research mainly focuses on the mechanisms and treatments for diabetic retinopathy. Diabetic retinopathy is a major complication of diabetes, and it is also the leading cause of blindness in the working age population. So diabetic retinopathy is one of the most feared complications in people who have diabetes. And our research is mainly focused on how diabetes causes damage to the retinal cells. And one of our projects funded by ADA is to look at the mechanisms caused by ER stress. So what is ER stress? ER stress is actually, in our new discovery, we found diabetes will affect the function of ER, which is endoplasmic reticulum. So ER is the protein factory in the cell, and diabetes causes damage to the ER and further induce inflammation and cell death in the retina. So the ADA funding helped us to further dissect what's the key pathogenic factors involved in this process, and what we can do to prevent the damage caused by ER stress.
The American Diabetes Association has funded over $8 million in research here in Oklahoma City. The goal of this research is to find a cure, but also to deal with the complications due to diabetes. Complications deal with blindness, heart disease, kidney failure, and amputations. The American Diabetes Association is the association that funds research in all types of diabetes, type 1, type 2, and gestational.